Hey, how are you?
Hello, I'm fine. My name is Rhonda Gully. I'm a nurse practitioner student at Maryville University, and I'll be conducting your interview on your history. And I'm going to go over present history, your past medical history, surgical, and family history. Is that okay with you?
That's fine, thank you.
All right, thank you. Can you tell me what brings you in today?
I have this terrible pain in my stomach right here.
Okay, right upper quadrant?
Yes, ma'am.
And does that pain radiate anywhere?
Yes, it does, to my back.
To your back?
Yes,
okay.
ma'am.
And when did this pain start?
Right after I had a heavy lunch.
Was it any fried, greasy? What kind of food did you eat?
It was meat and potatoes. I'm a meat and potatoes kind of guy.
Okay. And has that pain come and go? Has it been constant, intermittent?
It's been constant.
Constant?
Yes.
And how would you describe the quality? Has it been sharp, dull, stabbing?
It's been sharp.
Sharp pain?
Very sharp, yes.
Okay. And did you have any associated symptoms? Any nausea, vomiting, diarrhea?
I was throwing up earlier, have a little fever. My eyes seemed a little yellow when I came. Before I left home, my temperature was 100.5, but when I got here, it was 100.1 or 101.
Okay.
101. Yeah.
And you said you had chills?
Yeah, I got chills too, and like I said, I've been throwing up. I was a little nauseated. I feel sick in the stomach.
Okay, gotcha. And have you had any bleeding or recent change in your weight?
Well, I've gained about 20 pounds, but I haven't had any bleeding or anything like that.
Okay, no chest pain or anything like that? No shortness of breath?
No.
Okay. All right. On a scale of 0 to 10, how would you rate your pain? Is it still pretty bad right now?
It's a 10. Yeah, it's pretty heavy right now.
Okay. Thank you. Have you been on any new medications?
I was supposed to take this one drug.
What's it for?
It's for my diabetes.
Is it oral?
It's an oral, yeah. I take it.
Metformin.
I think it's a metformin. Yeah, the metformin. I
Okay.
take that, but when I don't like taking medicines, but I take that.
That shouldn't cause any pain. What about your bowel and bladder habit? Has any of that changed?
No, it hasn't changed.
Okay, great. Okay, well, I think I have enough information for what's going on there. Can you tell me a little bit about your past medical history? Have you been diagnosed with any illnesses?
Well, I've had gallstones in the past, twice actually.
Okay.
And I have diabetes and hypertension and high cholesterol.
Okay. Anything else?
Well, I had a scope, what they call a lap something. It's some kind of scope that they did on me recently. It's outpatient surgery.
Like
they checked me out. It's an exploratory lap.
Okay.
Yeah, and they were checking out my gallbladder, and I had gallbladder stents, and they've been removed since.
Okay. Okay. And so that's the only surgery that you've had was exploratory lab,
yes.
And you said gallbladder stents?
Yes.
Okay, gotcha. What about your family? How are your parents? Are they still living?
Well, my mom is, but my dad has passed.
Okay, and is your mom well?
Yes, she's fine, other than she does have diabetes.
Okay, that seems to run in your family.
Yeah.
Do you mind me asking what your father passed away from?
He had a heart attack.
A heart attack, and what age?
He was 73.
73, okay. Do you have any siblings that have any illnesses? I
have a brother who is also diabetic, and he's obese.
Okay. All right. So now we'll move into your surgical history. I'm sorry, your social history.
Okay.
Do you smoke?
No, I don't smoke at all.
Okay.
No tobacco products.
No tobacco products at all. Do you drink?
Socially, on the weekends.
And how much would you say?
6-pack, 12-pack of beer, over the weekend, with friends.
Okay. Any illicit drug use?
No, no drugs.
Okay. And what about your diet?
Like I said, I'm a meat and potatoes kind of guy,
Do you eat fruit, vegetables, fiber?
No, I don't eat any of that stuff.
Okay. And do you exercise at all?
Not at all.
Okay. Are you married or single?
I'm married.
Do you have any children?
No.
Any extramarital affairs?
Not at all.
Okay, good. And what's your highest level of education?
I graduated from Southeast Missouri State University.
Okay. Are you employed currently?
Yes, I am, and I'm an IT specialist.
Okay, perfect. Do you have any religious preferences?
I'm Baptist.
Baptist, okay. Well, you have right upper quadrant pain.
Yeah.
It radiates. You've had nausea, vomiting, fevers, chills, and all of that good stuff. and it seemed to be associated with a large, heavy meal. You've already had a history of problems with your gallbladder. I think that you have cholecystitis, or either cholelithiasis or cholangitis, which basically just means there's inflammation of the gallbladder, or either blockage in the cystic duct from which the bile flows. And bile helps us to absorb fats and turn that, use the lipids and everything. So that's probably why after a large meal you have pain. So you have a buildup of bile salts or cholesterol in the gallbladder, which will cause the obstruction or inflammation. So what I want to do, especially because you had a fever, I want to get some blood work on you, get a CBC, look at your white count to see if you do have infection. And I'd like to look at your liver enzymes, so I'll get an ALT, AST, alkaline phos, and probably a bilirubin. And then I do want to get some imaging. I'll get a CT of your gallbladder to look at the inflammation, and a HIDA scan to look at the flow of bile and how that's doing. And then I'm also going to get a surgical consult. So we will be admitting you. After a couple of days of antibiotics, I'll probably put you on some Zosyn, 375 milligrams every 6 hours, for about 7 to 10 days.
Okay, what about the pain?
The pain, we're going to take care of that. I could give you Percocet for that. Are you still having nausea?
A little.
Okay, I could give you Compazine for that. Surgery, if they want to operate after the inflammation is going down, after a couple of days of antibiotics, they'll probably take you in about 48 hours, so a couple of days.
Okay.
Okay. If you can you lie back for me and just relax your abdomen?
Oh.
You're pretty tall.
Yeah.
Okay. I'm just looking to look for symmetry, lesions, maybe abnormal pulsations. Everything looks good. I'm going to take a listen. You still have good bowel sound so far. That's good. Tell me if you feel any tenderness when I push.
Yeah, right in there on the side, yeah.
Okay.
Yeah, over there.
Sorry.
That's okay.
And take a deep breath for me. Pain there?
Yes.
Okay.
Yes.
All right. Thank you.
Thank you. Thanks for helping me.
I'm going to get some pain medicine started for you and take care of your nausea, and you'll be feeling better.
All right. Thank you so much. I appreciate you.
Not a problem.
All right.
Take care.
Thank you.